Welcome to a brief demo of our population health software, Arcadia Analytics. I will be focusing on pediatric-specific use cases and key aspects of the tool. If you have any further questions or would like a detailed demo, please reach out to your practice transformation advisor. In order to access Arcadia, you'll need both internet access, preferably Google Chrome, as well as an email address. Once you've logged into your specific practice environment, you'll be directed to their homepage with an activity feed. I want to preface that I am in a demo environment today because we do not want to share any PHI information. So there are going to be some aspects that are not populated with data. However, when you are in your practice's environment, every aspect of the tool will be populated. I'll try my best to call out those instances as we walk through. So the activity feed is really great place to just touch base as you log into the tool with any notifications or changes that have occurred with Arcadia, such as upgrades, configuration changes, or additional things that Evolve have created on behalf of your practice. This also is a great place to see for yourself as an individual user any notifications regarding reports that have been shared with you, tasks that have been assigned to you. Tasks can be outreach events. If you were to look at a patient for an assessment, those type of things. And you can easily filter on what aspect you're looking at through the drop-down and activity feed. Again, this is not populated because we are in a demo environment, but it is a great source of just overview, high level of where we are with the tool. There are some main things that will follow you as you use different aspects of the tool. Looking straight at the bottom, you'll see the user manual, share feedback, report issue, and about tabs. If you click on the user manual, it actually takes you to a great comprehensive guide of the entirety of the tool, from the methodology that sources reports, how the algorithms behind the quality gaps are closed, how attribution occurs, etc., etc. This is really a great resource as you're playing with a tool or something doesn't look just right to understand what the background is. Evolve will be supporting your training and ongoing support in your day-to-day, so this is kind of a document that you'll use if we're not available to provide that support to you, or if you're just bumping up your knowledge. We don't expect you to spend a ton of time in this resource or know every single word that's on the pages, but if you do need that quick guide, it is available to you by clicking user manual at any point. Share feedback and report issue. Those things will also be sourced through Evolve. You'll be sharing your feedback and customization needs with us, as well as any report issues, and we will report and escalate to Arcadia when needed. The purpose of that is that since we're helping you implement this tool and the ongoing support, that we will be able to customize a lot of things on your behalf and also address a lot of issues without escalating to Arcadia, and thus provide you resolution in a more timely manner. And then About tab is really helpful once you've gone live and have multiple claim sources. Again, we're in a demo environment, so these dates are arbitrary and not actual dates. Last update references when the last update of data have come in, and this will be on a daily basis, as your EMR data will come in daily, along with potentially some claims resources. Last service date speaks to actual claims service date, so let's say for today, if I was logging into Arcadia, I would see November 13th, 2018 as the last updated, but I may see that that was claims through November 1st, and so November 1st would be the last service date. And then last measure reprocessing is actually when the gaps in care are recalculated. This will be the same as your last updated because that occurs in our configuration on a daily basis as well. So what information you put in your EMR today will close the gap in Arcadia tomorrow. There are also 5 tabs on the top: performance, utilization, patient, risk, and operations. Arcadia has deemed the most important reports that practices can use in their workflow that really leverage the greatest parts of the tool, and they've made kind of essentially quick links to them in these tabs and divvied them out by what you're trying to do. Again, everything in Arcadia is customizable, so if there's a report here that doesn't fit your needs, we will support you in building that appropriately, and especially those ad hoc registries or ad hoc needs, really leverage our analytic resources to do that for you. But in general, we've learned that in the typical workflow of closing gaps in care or pre-visit planning or risk stratification of your population or cleaning up rosters, member attribution reports, those are already built commonly in Arcadia, and what you can use to filter and sort them for your specific needs is this green tab to the left, which is called the Arcadia Global Sticky Filters. Here you'll have all types of options to actually filter down the report to what you need. So let's say you run a generic report on gaps in care, but you only want to know your patients that are ages 0 to 13, and you want to disregard the other age categories for the specific purpose. You'll be able to do that through these filters and apply. The reason that they are called sticky filters is, let's say I'm in a performance report and I apply that 0 to 13 age criteria. If I go into a risk report and go to patient detail, again, I'm only going to see those patients that are 0 to 13 years of age. So it sticks through as you go throughout the tool. The way to revert that is either to come back to the filter and remove the filters that you have, or if you start a new session, those filters will automatically return to default. The great thing about that is that if you really dwindle down and want to report a specific population that you're targeting, but you want to go from gaps in care to ED utilization, and you don't necessarily want to remember that you've limited it on time frame, an age category, a payer, a line of business, that if you put those in that one report and you move on to the next, you'll have that ability to just keep those static. The other thing you can do in Arcadia, and I'll share once we get to patient detail, is actually save subsets of specific patients. And as new information comes in daily, based on your filters, new patients will come in and out of that denominator that you've created. That's really helpful when you know that you're doing a targeted intervention with patients that are under 10 years old, that haven't gotten their immunizations and don't have an appointment in the next 6 months. Those types of things, those really specific to your practice workflows, can be easily created using the global filters, and then creating a subset of information or criteria for your report. So I'm going to start just walking through the tabs briefly. Performance is really your quality gaps in care. We, as Evolve, have built each of the community contracts, both your value-based contracts and incentives. And with Arcadia, you're able to limit your user credentials. So while Evolve has built most of the contracts that are out there in the community, you as a practice will only see the ones applicable to you, as well as only the pediatric versions of those contracts, so that you don't have a list that is 100 long and you have to sort and find the 5 or 6 contracts that you're tied to. So I'm just going to switch over briefly quickly to the performance tab in our Evolve environment. Like I said, we've built most of the community 2018 contracts, and you're not going to see this whole list. You are going to see limited to 2018 pediatric reports and specific to your practice. If you have, are you doing MIPS? Are you in OPA? Are you in TPC? Those types of things. Again, only the ones that are specific to your practice needs, and they will formally build out the measures that you're tied to through those contracts. So assuming one of those is under commercial pay for performance, what you'll see when you first log into one of those initiatives or contracts is a leaderboard. This is a quick snapshot of performance of the practice. It's a great way to see the variance between physicians and also identify where there might be opportunity. Is one physician closing more gaps in care than the next? And what are they doing differently? And that can really help the practice move certain gaps in care, or identify different processes and workflows that more efficient or not. It also has the ability to have focus measures, which will call out specific measures that your practice wants to focus in within a contract, and identify kind of the providers and the most gaps, your overall practice compliance, and how many gaps you have and how many patients are in the denominator. Moving down, what you'll see here is an overall snapshot of the contract. So this practice is at 59% of the 22 measures. They have 13 above the target or goal and 9 below. And here you also see the top 5 measures with the most gaps. And if you click over, you'll see actually how many gaps that's related to. Again, because we're in demo environment, this is not specific to pediatrics, this is adult measures. When you have your practice in the environment, you will see pediatric only measures based on what contract you're viewing. Now, if I want to target the patients in this contract, but not specific to any measure, and I want to go across all 22 measures, I click detail and I get an initiative detail. I want to look at this because I want to identify patients that for the specific contract have the most gaps in care potentially, or I may use this as a source or a list to then tag ED utilization or inpatient visit or cost into to develop a more comprehensive view of the patients that I need to bring in first if I need to prioritize. Again, some functions I want to call out. You're going to see that the global filters are still over here with this green tab. You still view the 5 tabs and the 4 on the bottom. You're able to easily sort or filter any field by using either the global filters or by hovering over, and you'll see these 2 arrows. If you click, it sorts from largest to smallest or smallest to largest. You also can use the box that's under to actually filter it out. So let's say I want to just show anybody that has that is in the denominator for 10 or more measures in that contract. And if I simply put greater than 10, it will return the 3 patients that had 12, 11, and the 2 with 11 qualifying measures or measures that they're a denominator with. You can do that for any field, and you can also remove a filter by simply deleting and pressing enter. This report also shows you specifically to each of those measures where the gaps are occurring if you want to do further detail. 1s mean the gap is filled, 0 means there's a gap that occurs, and blanks mean they don't qualify for the denominator. If you scroll, you'll see all 22 measures listed here. Another thing is, let's say you want some additional information around these patients that will help you aggregate it or bump it up to another list, or just information you need when providing care. You click on this dial and you'll actually be able to check box any fields you want to add and remove the check for any you want to remove. If I go back and I say I want to target those that have greater than 10 qualifying measures, and I click the 3 patients, what I can do is actually add selected patients to a list. So I'll say gaps greater than 10, pay for performance, and save that. You can actually then use that report as you go on to a next item, and it will bring in these 3 specific patients rather than having to remember that who these 3 specific patients are based on this view of information. At any point, if you want to go back to the home screen and see the activity feed, you press the button. You can go back to where we were either by pressing the back button or clicking pay for performance. Now, looking at a specific gap in care, you can see the performance of all the specific measures within that contract. Red dictates that you have not met the target in the black line, and blue dictates that you're above the target as a practice. Looking into Well Child 3 for 6, what you'll see is when you click on a measure, you'll have the change over time, and you'll actually see the performance of Well Child 3 to 6 and the goal 50%. You can also change that to look at, let's say, a week, which only has one aspect right now, or a month to see how you're trending. Again, this is reflective of your permissions. If you have an entire practice, you'll see everybody's information in here. If your permissions are restricted to your own specific patient panel or a patient panel of a couple of the physicians, but not all, you'll only see the data related to that criteria and not the entire practice. So these charts, both the leaderboard and the change over time, are really helpful for those users that are responsible for tracking performance in your practice and really need to understand how you're performing as a whole. Once you've clicked on that measure where you see the numerator and denominator and how many gaps you need to close to get to the target, you'll also see that not only does it update the graph, but it updates the provider comparison. Again, you can change this by multiple things. So if I wanted to do it by age range, because this is 3 to 6, you only see one age range, 0 to 13. If I go back to provider and I click on denominator, again, it easily sorts largest to smallest. So we know that Dr. Lee has only closed 3 of the 121 patients with this gap, but Dr. Rojas, although she is at a higher percentage overall, she really doesn't have as much volume. So we may want to understand what she's doing to close a couple more gaps, but really see how we can help Dr. Lee bring in those 121 patients. Now let's say you need to know who those 121 patients are. You'll come down to the outreach tab, which is different than all detail tab because this is specific to one specific measure versus seeing all the patients that relate to any of the measures in this contract. You can view these patient registries by looking at upcoming chances for appointments already scheduled in this upcoming week, ones that you've missed in the previous week. Maybe you want to circle back and bring them in if it's appropriate, or you can just view all gaps regardless. Again, you'll see the same kind of layout as the all detail tab. What you'll see is that the denominator and numerator are 0 or 1 because we're looking at one specific measure. You're not going to be able to sort this and see anything more than 1. You're not going to see the 10 or 11s or 12s that we saw across the 22 measures, and you can see the list of listed measure that you're viewing here. Again, you can return back to where you were by clicking the back button or clicking pay for performance, and you'll see things update as you click other items. Moving on from this gaps in care report, this is really a great way of running registries and understanding performance as the practice and identifying those actionable patients that you want to reach. It is especially important for pre-visit planning or for performance monitoring. But if you wanted to add additional pieces of data to your treatment plan or just your knowledge of the patient, you can use the additional tabs. You have utilization, which will be leveraged once there's claims information in Arcadia. And each of these utilization tab reports share different detail. You have medical expense management, which will actually break it out into inpatient, outpatient, pharmacy, professional visits. You have then the ER reports, ER high utilizer, a discharge follow-up report, and overall utilization detail that can source your medical expense. The great thing about these utilization reports is that they do also some distribution mapping right there, so you can actually see where your patients are targeting. The reason you don't see any information right now is one of two things. One, because we're in clinical data, there's no EMR information around these ED visits. Again, the source is claims more often. And also because this is looking for a specific time frame where there hasn't been any ED visits in the demo environment. This is likely not going to happen to you at your practice. You're always going to have at least 1 or 2 ER visits per week. But as a frame of mind, it's good to know that if you don't see data automatically populate, it's typically usually related to either the fact that the report doesn't source from your EMR and it really needs claims information, or it's tied to the appropriate time frame. So when I open up that time frame to go back to the beginning of the year, you see that now we have data related to the ER visits, and it takes a little time to just bring in those additional items of the report. But you can click in any box and actually identify how many patients had an ER visit, what's their average per member per year cost, what's the visits per thousand, what's the cost per ER visit. And once this populates, usually it does not take this long, so I'm not sure. If I toggle back to clinical, you're going to see very little detail. If I toggle back to claims, for whatever reason, this is taking a little bit long, and I don't want to hold up the demo. This might be related to the demo environment and the data on the back end, but what you'll see is a similar report where you're going to be able to break the visits up by place of service, and then for all your providers be able to see ED visits, percent per thousand, how many unique patients, the cost per ED visit, and then also be able to click through and see the specific patients that it's related to. Now going into patients, this is where I want to spend a little more time. There are two main reports here that you're going to be using. One is the patient registry. This patient registry essentially gives you all the detail of all your patients and their risk, their age, demographic detail, and also what diagnoses they have come with. This is a great opportunity as far as pediatrics to ensure that you're coding appropriately for diagnoses that have occurred in the past. Although this is not as frequent as in the adult population to have multiple comorbidities in your pediatric population, it becomes more important that you do ensure that you're accurately picking up all diagnoses that are pertinent, because the risk is typically healthier in your population, and you want the payers to understand the true risk of the pediatric population that you're serving. So this report shares by condition whether a gap has been closed, where it's filled in, which means that it has been coded, or if it's open, the weighting of that score into the risk. So lighter means less, darker means more weighting into the score, and then you have an overall risk score. So for example, this patient, based on demographics and previous history, is a risk score of 1.7. However, they have an open risk of 1.1. So right now, based on demographic information, they're a 0.6 risk. Although reality is they're a 1.7 because there's a heart and an injury condition that both have not been coded in this year, but have been coded in the previous year. Again, like all the other reports, you'll be able to click and add additional columns or remove additional aspects of the report. At any point, whether it was through performance or the ER report, if you click on a specific patient, you get to the patient context card. Here you'll see a list of different cards that tell you how the patient is performing. I want to just be sure that you're aware, again, we're in the demo environment, so there are some items that are not populating, and this will all have information once you are in your environment. The patient context card tells you high level kind of last visit, payer, if there's a cost associated with that patient, their risk. You have quality gaps, which show in two columns, overdue and out of range. So let's say that a depression screen is overdue because you haven't done a depression screen since 2015, but you may see BMI out of range. You've captured the BMI sometime this year, but it's out of range. So as a provider, you don't want to just check the box and say, yes, I've captured the BMI. You want to keep an eye on that BMI because it's not what is expected. For conditions, this comes to gaps. For pediatrics, you'll be using ACG, not HCC, because of the population that you work with, and you don't have a lot of Medicare patients. So when looking at ACG risk scores, here you are identifying the detail of items that have been coded in years past and that are no longer coming in these claims this year. Now, there are items that may have resolved, especially with the pediatric population, or when it comes to more more intense treatments and care. They might be, such as cancer, they might be in remission, and you don't necessarily want to just code it in this year because it's not something you're currently treating or thinking of when you're doing treatment. So you're allowed to edit and be able to dismiss the condition for multiple reasons, whether it's resolved, you don't agree with it because a claim came in from specialist or some other type of data source, and from your information that you have around the patient, you don't believe that's an accurate diagnosis, readmission, or that it's entered an error even on in your EMR. And so if I were to do that and plus dismiss, that condition would essentially never show up again. It will be grayed out so that I could reactivate it if I want, if I did it by mistake. However, the good thing about this is that you don't see those this condition keep popping up when you're looking at reports around the coding opportunity. What you need to keep in mind is that this does in Arcadia, but Arcadia doesn't currently now push back into Menet. So you will need to make sure that if you dismiss the condition here, that you dismiss it in your EMR as well. And that's where the pop-up will come into play. And so I'm just going to switch over quickly to show you what the pop-up looks like. So the pop-up essentially is a screen that you see that leverages from your EMR, and it pops up like a instant message. You don't actually have to leave Menet and log into a URL like we're walking through the actual interface. This is something that you can use in your day-to-day current workflow without having to toggle multiple screens. It's really great because it does show you different items. So if we're looking and pretending the white screen is your EMR and it's Menet, and you're in a patient chart, what you're going to see here is the actual pop-up. And like I was speaking to just a minute ago, you have potential HCCs or ACGs not coded, and you'll be able to see them right while you're looking at the patient chart. So if that information is not in your EMR, or your DMHM reports aren't appropriately running, or you haven't billed it this year but you billed it 3 years past, you'll be able to see this all through that pop-up, along with quality measure gaps, recent medications, and recent utilization. And this will provide a supplement to your EMR for additional information based on the data that we have flowing through Arcadia and their methodology to help you provide care with the most holistic view of your patient. And again, this is a great tool because it doesn't require you to leave Menet at any point, but rather toggle back and forth, but rather using it in just the patient's chart and having that view into that additional detail. If you are wanting to get more detail than is on the specific pop-up for one-off patients, you want to dig more into the data that's in Arcadia, you'll be able to simply click that patient's name and it will take you back to the patient's card, and you'll land here where you can see more detail to that patient. So there is ability to tie what you're seeing in the pop-up back into the interface, but for what you're doing as a provider and even with pre-visit planning, unless it's more population health and really specific patient visits, you'll need to leverage just the pop-up and nothing more. And there are a bunch of different cards. You got medications, you've got the problem list, and you got basic demographics. You also have attribution, which is great once you have claims resources, because then you'll know who's been attributed to the practice, or you as a provider that has not come and seen you, who you have in your EMR as your patient but is seeing someone else in the practice more frequently or more often. There's a lot of roster opportunities around cleaning up or reprioritizing how you're listed in the medical records. And then you have a preventive section around some basic lab values, and then based on each patient's diagnoses and problem list, you'll have certain cards populate. So for this patient, a hypertension populates, and you'll have some lab values specific to that one diagnosis. Again, you'll have those tabs. You just X out, and if you click on any of the patients, you'll get to their view. And then I'm just going to quickly go through. You'll be able to see a network summary of risks. This really identifies for your specific practice what your risk is, what the risk adjusted factor is. If you go into the patient view, you can actually see where the risk is coming, whether it's your problem list, whether it's an assessment, whether it's historical information. This is really helpful when you're digging into one specific patient, trying to understand where things were coded from, and will allow you to identify the most comprehensive view of the risk of the patient with those additional sources. Again, if I click a card, you're going to have a slightly different view of this patient, and this is specific to risk, and since this patient didn't actually have any risk, you saw that nothing populated. So I'm going to go down to somebody who has a little more risk. You're going to see exactly what the conditions are, where they're pulled from, the weight of the risk, and whether it has been coded in years past or not. So in this case, these have been coded, but the chronic kidney disease stage 4, which is not applicable to peds, but just as a use case, has not been coded this year. Most likely, this patient still has chronic kidney disease, especially since it's stage 4, and this does need to be captured. If you click full record, you're going to go back to that patient's card in the typical format of where you see all these different information. One thing I want to call out that I didn't previously around quality gaps is that, let's say a patient has a fall risk assessment, so let's say that's a well visit or an immunization, and you didn't actually have any information in your EMR specific to that, nor did the patient tell you, and you didn't offer it from your practice. You'll be able to see here that, let's say the fall risk is an immunization, a flu immunization, that it's done, what date it was done on, and also where it has been done and which provider. So when it comes to closing gaps in care, if you don't have the appropriate documentation in your EMR, but you don't necessarily know where to start, this is a great place to know that not only has it been done, so you don't want to do it for your patient, but you can actually reach out to that specific hospital and provider to get that information documented in your EMR. Again, your EMR is still the source of the truth. Arcadia is a supplement to that data. Lastly, there's the My Analytics page, which basically are those custom reports that you've created that have been shared with you, patient lists like the one we've created, gaps in 10, over than 10 for pay for performance, that are owned by you, that are owned by others. This is where really the ad hoc customization piece of Arcadia comes into play, and if you're using those global filters, or you got to a specific, three patient list, or 100 patients that you want to just follow throughout the year, this is where really you can make sure that you've saved that, so you don't have to reiterate that process or do that legwork each time you log in. And that overall is a very broad view of what Arcadia is utilized for. Again, if you have any further questions or want more detailed demo, please reach out to your PTA, and I'd be happy to spend some more time with you. Thank you.